right, good afternoon, everyone, or of course, good morning if you happen to be joining us from the West Coast. We're excited to kick off the year with our first installment of the Alliance's DEI Conversation Series. My name is Deanna Fenton, and I have the pleasure of serving as the Senior Manager of Educational Program Development here at the Alliance. Now, today we'll be exploring the powerful impact of our words and how they affect our daily interactions. In this three-part series, we'll introduce a case study that describes the deadliest incident of violence against lesbian, gay, bisexual, and transgender people in the history of the US, the Pulse shooting. Now, as the story unfolds, we'll dive into the complexities surrounding this heartbreaking event and apply lessons learned to improve our daily practices to effectively support the diverse communities we serve. In this particular session, our panel will reflect on the incident and share their experiences on how words have positively and negatively impacted their day-to-day interactions with patients, colleagues, and families. Additionally, the panel will explore ways healthcare professionals can lessen the negative impact that their words have on their patients and their families, especially in underserved communities. Now, following today's panel discussion, we'll transition into our collaborative breakout discussions where you'll all have an opportunity to connect with one another and apply the lessons learned to identify strategies for you and your colleagues to implement in your everyday practices. Once we've concluded our breakout discussions, we'll return to the main session where we'll collectively share some of the insights and key takeaways captured in your respective breakouts. Now, one thing I want to emphasize is that this is meant to be an interactive, engaging learning opportunity. Having said that, please take advantage of the chat feature located at the bottom of your Zoom window. If you have any questions for our presenters, please feel free to submit them at any time using the chat box. Likewise, should you want to add to the conversation and share your thoughts, you're welcome to submit your comments at any time. Lastly, for anyone who may be interested in continuing education credits, please note that we will be offering one CEPC credit and one nursing contact hour for your participation today. Following the conclusion of the program, you'll receive an email from us with detailed instructions on how to claim your credits. Having said that, even if you're not interested in CEs, we highly recommend obtaining a certificate of attendance so that you can complete the post-event evaluation to provide us with your valuable feedback. Now, at this point in time, I'd like to go ahead and begin today's program by giving a warm welcome to our moderator, my former colleague, Katie Aguiar, founding principal of Fundamental Roots. Joining her is Sherry Berger, who serves as the Executive Director of Public Trust and member of the Alliance's DEI Committee. Ladies, it's such an honor and a privilege to have you both with us today. Sherry, at this point, I'll turn it over to you to first introduce today's case study, which also happens to be your personal testimony of the Pulse shooting. Now, before you begin, I just want to thank you in advance for your willingness to share these sensitive details with the group. Thank you.
Orlando's finest law enforcement, along with every type of first responder, assisted as difficult information was given to these hurting families and friends. Several needed medical assistance as the painful information was provided to them. We all know the numbers: 49 killed, dozens wounded, and millions asking why. Hundreds of family members were grieving, along with our staff, our city, our nation, and our globe. I missed seeing Hamilton win 11 Tony Awards on that Sunday night, but I lived and experienced a portion of the elegant acceptance speech made by its creator, Lin-Manuel Miranda. He said, we rise and fall and light from dying embers. Remembrances that hope and love last longer. And love is love, and it cannot be killed or swept aside. My prayer is borrowed tonight because I'm exhausted and because his words were perfect. Good night and God bless. And I said a prayer that night, and I said, Father God, tonight I am praying that you will comfort those who have lost loved ones and friends from senseless violence. I pray specifically for the families and the friends of those who lost their lives. I pray for healing and recovery for those who are fighting to survive. God, I pray that you will comfort them, that you will reassure them that you're still in control and that they are loved by you. God, I pray that we may all continue to have faith in you and your promises, even when we don't understand why this happens, even when we are angry that this happens, even when we are overcome with our fears and sadness. God, help us to continue to trust. I pray for peace during this time. I pray for healing for the city of Orlando and all cities that are dealing with violence that takes the innocent. Comfort those without brothers, sisters, mothers, fathers, friends, mates, partners, and children due to this violence. God, send them your comfort as they mourn and remember their loved ones. I thank you for hearing my prayer. In your name I pray. Amen.
Thank you, Sherry, for having the courage to share this very terrible tragedy that I'm grateful that you were there to be able to assist. But thank you for sharing that. And I think what might be appropriate for all of us at this point in time is to just kind of take a moment of silence. I encourage all of you to close your eyes, because this is a lot to process right now. And so let's just kind of close our eyes, take some deep breaths, acknowledge this happened, and that today we'll have an opportunity to process together and hopefully find some learning through this devastating tragedy. So let's just take a moment of silence for that. Thank you. We realize that this is a very, very difficult topic and a very difficult tragedy that we are going to be exploring in a little bit more detail. And so we want to acknowledge that this can trigger many people on this call today. And there is a lot to unpack in this scenario. And so that's why we have divided this into a series. And this is the first part, which will focus on understanding the impact and the power of words. So just before I introduce the panel, I'd like to make a bold request of all of you who are participating today. We are all learning, and we do want to be intentional with our words and identify what is appropriate in which context. That being said, usage of verbiage can be very personal, and words can have different connotations to different people. So we'd like to ask you if any of us as panelists or the participants in the discussions utilize verbiage that you find triggering or offensive. Please know that that is not our intention. That being said, we are all here to learn. And so we do invite you to correct us and educate us, whether it's through the chat while the line isn't open yet, or in the breakout discussions in the conversation. Please do educate us, because we are all here to learn. I also encourage everybody to reserve judgment and to just extend a lot of grace and recognize that each person on today's call here today will have their own perception impacted by the filter of their own life experience. And so I encourage you to listen and learn from a place of humility. And that applies to all of us, me included, to choose to listen from a place of humility to gain a better understanding of each other and about each other. Ultimately, the goal here is not to change your own values, but to seek to learn to understand and respect other people's values. And so that being said, I'd like to introduce our panelists for today. And I know that, Deanna, I think you have the slide there, perfect. We're gonna hear from Tatiana Quiroga first. She's the Executive Director of Come Out Pride Orlando. And then we're going to hear from Ingrid Palacios. She's the Multicultural Community Outreach Program Manager for New England Donor Services. And then we'll also be hearing from Glenn Mitsuki. He's a program consultant with the Alliance and an old dear colleague of mine. And then Ramona Chapman is also part of the discussion today. She's the Director of Public Education and Community Relations at Gift of Life, Michigan. And then Kareem Ali, he's the Chief Relationship Officer for the Muslim Life Planning Network. So thank you to all of you for sharing your time with us today. And so my first question is really to open it up and ask, is there anything in this case study that most impacted or resonated with you? And why? And maybe more specifically, was there anything in the verbiage or language usage that was particularly triggering for you? Tatiana, what is your perspective?
Hello, everyone. Thank you so much for having me. And as Heidi said, my name is Tatiana Quiroga. My pronouns are she, ella, and I am the Executive Director for Come Out with Pride. We are the local Pride organization here in Orlando, and we host the annual Pride celebration. We're very proud to share, one of the largest in the Southeast. And, you know, hearing this case study and having to relive those moments, you know, and I thank Sherry so much for doing it so eloquently, empowering through that, knowing that it is truly still traumatic. It is most definitely an open wound for us here in the Central Florida area, and especially particularly those who are in the LGBTQ plus community and the community of color. As a Latina who lives in the intersection of, you know, being Q Latinx and being a lesbian, and knowing that Pulse happened on Latin night, you know, it really was something that, you know, was completely an attack on my people. A night like that, it's more than just a nightclub. If you're not familiar with the LGBTQ culture and community, we have a history of not having many places that are ours. And that are, you know, opening and inclusive and welcoming. And so gathering spaces like that is really where we find community, build community, feel safe. And in particularly, since we're speaking of language, having a Latin night, it's an opportunity for those of us who can, you know, share that multicultural experience with others who are living in that, you know, duality of, you know, being in multiple cultures and languages. So it really, you know, Pulse was more impactful than I'll probably be able to ever, you know, truly verbalize. You know, it is something that is still very much at the top of agendas here in Central Florida, even though, you know, we're going on to 6 years. It has changed the culture here in Orlando, and it's changed the movement, and particularly the LGBTQ plus community and where we've gone. Some major silver linings have come from the tragedy. You know, even creating spaces like these and having these, you know, educational conversations where we're looking for growth and learning opportunities and to continue those conversations. Also, too, organizations have grown from this, realizing that there is gaps in our community. So, you know, we take solace in knowing that, you know, our 49 angels did not die in vain. You know, there definitely was a lot of silver linings that have come from there. And, you know, and wanting to, you know, bring it back around, since we are speaking of language, you know, there's a lot to specifically unpack when talking about Pulse, because again, we are, it was an LGBTQ plus space and, an attack on our community. But again, with the multicultural component of it, there, it greatly impacted the Latino community here. So then there was lots of folks that, as Sherry talked about, where English was not the first language. So meaning when families came to, to find their loved ones, to hear about their loved ones, to, it was a call to action to our community to really, make sure that those families, and particularly that English was either their second language, English being their second language, felt supported, because we had, members from all over Latin America coming to see, where their loved ones were. And even, more than even language were the cultural components that came with them. So then there was, there again, there's a lot to unpack when particular looking, at this case study, and just simply so grateful that we have these spaces.
Something that you said really struck me. You said it was attack on our safe space.
Mm-hmm.
And I think that was a really powerful phrase there, because I hadn't thought of it in that way before. So, but yeah, lots of dynamics that I think a lot of us hadn't really considered up front.
Yeah, there are a lot of dynamics that go into it, because lots of times we look at these situations in a binary, right? We look at them either, we're specifically talking about like race. So we'll talk about, white or the communities of color, or, or we talk about, the LGBTQ plus community or our heterosexual community, right? So there's a binary lots of times in the situations when we converse about, diversity, equity, and inclusion. But what is an added component to this is that we have those intersections are also being affected by the cultural components. So even though we've got, for instance, the Q Latinx community that was, directly impacted, and then we have the family members who are coming with their Latino, language and history and component, they're obviously bringing, their cultural acceptance or lack thereof of the LGBTQ plus community. So then that even added more, there was even after Pulse, there was families who did not claim their loved ones. And so the community then had to step in and really provide support for that, for that person who passed, because for lots of folks, the families didn't know that they weren't out. And so since they were killed at Pulse, that automatically outed them. And the families at that point did not want to acknowledge them or claim them. So that's kind of where that cracks open that idea of that binary that lots of times we think of when discussing these topics, because internally there's a lot of, dynamics going on also.
Yeah.
Absolutely, Tatiana. And one area of that absolutely resonates as the truth of what we saw in every interaction was how the victim identified the friends, partners, and family were often identifying them with different criteria, with different gender identification. And it was very problematic in making sure that the identifications were correct. When a person standing in front of you said that they were a female or that they were a male. And then their families often arrived and they identified as a different gender and with different descriptions of what the victim might have looked like on that evening. And sometimes that didn't correspond with the gender identification that the families were making. So even from the very first point of contact, it became very clear that we needed to respond to the individuals looking for information with the same nomenclature that they identified as. So if they said it was a male, we responded, you are looking for a male, and then gathered as much descriptive information as we could. So you could not be more accurate in the identification being a very integral part of how we moved forward in every conversation.
And Sherry, I completely commend your team, because I could imagine that there must have been situations where folks were being openly outed at that time. Like you were saying, the discrepancy between, you know, how they identified and the language that they used versus who the family was looking for, you know, and having your team have to kind of, you know, maneuver that situation and be able to move forward. You know, that is just so tremendously difficult. So kudos to your team.
Mhm, definitely. Well, thank you so much for really starting to unpack this a little bit more for us in terms of how complex this is getting, because ultimately I think a lot of us hadn't considered the dynamics of the intersection of the ethnicities, cultural expectations versus then you have the gender identification intersecting kind of with the whole cultural dynamics that go with that. It's getting really complicated. So that's definitely something really important for us to learn. And Sherry, I look forward to hearing a little bit more, maybe down the line, if you are, just to plant the seed, if you can share with us, how do we better communicate in those situations? How do we identify people when we don't know yet how to identify, you know, or when you have a clash between what a family is expecting versus what the victim or the patient might be expecting. Ingrid, with your background and your role, what kind of perspectives do you have to share, and what kind of insights, what's triggering you at this point?
God, everything is triggering me. When this happened almost 6 years ago, I remember that I consciously avoid watching this news as a Latina because it hurt too much. So hearing Tatiana talking about, and like what you highlight also about being a safe space, you know, that cultural piece, it is very heavy. Like, it is very triggering, it's very painful. And I feel for Sherry and for Tatiana, for the people that were in real time involved in this massacre, who's, I think, the biggest shooting, or one of the biggest shooting here in the United States. And so it makes me sick that this even happened. So in preparation for this panel today, I watch all those news and all those videos that I avoid watching in real time, and they shook me. And I pray, like Sherry, I pray so much that it's been almost 6 years, this type of things, I don't think that ever go away. And I can imagine the families of the survivors and the families of the people which lives were lost that day. And so thank you for giving us the space for that moment of silence, for being able to share what really is in our hearts, and provide some discussion and some education about compassionate communication and the power of words. So transitioning that, and that I was talking about in a personal level. In a professional level, I was thinking, you know, about Tatiana spoke about silver linings, and I was thinking, if there were silver linings about these people or some of these victims being able to become donors, being able to save lives, how's the interactions with the families that probably some of them didn't even, if they were outside the country, they were probably not even spoke the language. Thinking about how important, when Sherry was talking about everyone that came together to help these families and these survivors, and just to help, the power of allyship, how important it is, and how important that, you know, we might not have the correct words in the moment, we might not, but our hearts are there with empathy and compassion to come together. Of course, with these type of programs, we want to, after all these years, to try to convey information, share information, and share and learn from each other about how appropriate, more, how can we, and you asked this question to Sherry, do better, or how can we, in other type of situation similar to this, can we provide communication and support that is accurate, that is respectful, that is compassionate. I was thinking when you guys were talking about the self-identification versus the family identification of either the victims or the survivors, what a conflict, what a challenge, right? Coming from the donation standpoint, when the organ procurement organizations get the call and get involved, because some of those people that died there were registered as organ donors and had registered their decision that they wanted to save lives if anything will happen to them, and leave that legacy. So that made me think about that silver lining, like that, and with hope that the families also in time at least took it as that, as the loved ones living on, thinking about the language barrier, the key importance of the medical interpreters or the interpreters as not only allies and advocates, but professionals in healthcare that also had to work with the organ procurement organization, reps, and everybody else that work helping these families, and how important was their role in that moment, being that bridge for communicating in one of the worst tragedies that this country have experienced. And so I know we're going to have a conversation, we're going to make of this a series, because it's just such a broad, it brings so many angles, and it brings so many things that we wouldn't make justice trying to cram everything in this hour. However, it is important to have some for us professionals that work with families that have lost a loved one and have made the generous decision to donate their organs, or have made the decision to honor that person wishes to donate their organs. It is important to know the importance of working with a medical interpreter, the importance of having those huddles with those medical interpreters to convey the sensitivity of the situation. In this case, I get this was, public knowledge, but sometimes it's not. So we need to make sure that we are compassionate, communicating with empathy, and being respectful, not only of the families that we're speaking with, but also of these heroes, as we like to call them, that have passed and are going to be saving lives. Considering that, the families usually tend to regress or prefer to talk in their native language when they're grieving, they're going through crisis. Being mindful of the needs, always knowing that this is always a family. Our processes as organ procurement organization professionals are always family driven. So that is what guides us. That's what gives us the cues and the leads. Considering many other complex aspects as immigration status, a lot of immigration status, which we will dissect and talk more in other conversations, is also a key piece on how we as a community get treated, unfortunately or fortunately. And so what services we have access to. And so just to have those thoughts and learning from each other to do the best to support our communities. So I think that'd be
I think what's helpful, Ingrid, that you just did for us is you're unpacking further things that maybe we hadn't even thought about or considered. I think you mentioned in our preparation call as well that there can also be a stigma around donation in addition to what we already learned in terms of other stigmas that were happening in this situation. And now you added another layer of complexity with the immigration aspect. And so, and then adding interpreters into the dynamic as well. So lots, I appreciate you kind of educating us that it's not that simple, right? There's a lot more deeper things that maybe we hadn't thought about.
Only the stigma, but the misconception about LGBTQ plus community unable to be organ donors. And so that comes, first, and then comes the discussion and the information. But I don't want to take time from the other panelists. And I am honored to be part of this panel. Thank you.
Thank you so much.
Ingrid, I just want to reiterate the validity of what you've shared about having an interpreter for the benefit of the participants. We unfortunately had to commandeer the second floor of the Hampton Inn, and in each of those rooms, death notifications were being given. And one area that we realized quickly we could make a difference in the experiences for the families was in providing a Spanish interpreter with us, and allowing the information to be spoken first in English by myself, and others who were trained in giving death notifications or a grave prognosis. And it's a topic we're all very familiar with, but when there's a need to work with an interpreter and allow space for the trauma to become realized, unfortunately, and absorbed, it took a significant amount of time. So the call to the community was very aggressively responded to, thankfully, but they were not all medical interpreters. In some cases, they were chaplains serving at hospitals around Central Florida, and others that had come to assist in a very difficult space of time. But the need for interpreters was as great as the need for the EMTs that were there on site assisting when families received the grave prognosis or the death notification there.
I think the one thing that is important to recognize is when people are in grief, it's important to offer that option of being able to speak in the language that they're most comfortable in to express their emotions. And if that means getting an interpreter, that's just good service to the family, right? Yeah, excellent. Tatiana, you had a very quick suggestion before we go to the next panelists on how to ask that question on gender identification.
Yes, I know, Heidi, you flat out, one of the questions that you had asked is, when speaking of gender at this point and knowing that there was a lot of going back and forth and maybe things weren't matching with what the family was saying and how the person identified, within the LGBTQ plus community, really the safest way when not knowing is just simply using they. Which is, it's a little bit of an adjustment, going from the singular to plural. But that really is, the really, you cover all your bases, and most people just simply love the effort and really appreciate the intention. So, and I suggest for people to try it out even with folks as pets. It sounds very funny, but whenever you misgender somebody's dog, they always correct you. So it is an opportunity to start practicing using they pronouns. And again, it's an adjustment, but it really is the safest way to make sure that, however that person identifies, that, it really is the most inclusive way.
Mm-hmm. Great, thank you so much for that tip. Glenn and Ramona, just kind of a nice transition from what Tatiana just said. How can we work to shift our language that is being used in the OPO transplant healthcare community to be more inclusive, representative, and culturally appropriate?
Ramona. I guess, Ramona, you and I should really go back to how during our planning session, and we were talking about words that really doesn't do any justice to our speaking to families or how we deal with families. And I think we talked about language that needed to be shifted in using within the OPO community and hospital. And I made the statement that one of the terms that I find personally inappropriate and offensive that we all use is escalation.
Mm.
You know, in speaking to families who are grieving, we're uncomfortable in the way that they're grieving. Or hospitals tend to want to escalate it to include security. So, I mean, that's, I think, what we were talking about. And what were your thoughts during our conversation?
Glenn, I would, definitely just echo what you said. I think as we talked about this, we also talked about things that might trigger us. And even though I've heard that statement, who lives and who dies and who tells your story, I realized on today, that's a different thing. Who lives are those persons that were shared, as you mentioned, Haiti, that have safe spaces. Who dies are those persons who feel as though that they are somewhat marginalized in language, in gender identification, and who tells those stories is so important for us to be sensitive to. And I think that just saying, as you said, about the word of escalation and calling security, and security for one group is completely a different trigger than to hear the word security for another. And so I think that, again, just being conscientious of those words and how we use those words and how we provide space to live and for people to tell their story in grief, for them to tell their story and how they live and how they love is something that I think gives us a wonderful opportunity to make sure that we are creating this safe space that dismantles some of these things that really are going against the grain of what it is that we're doing, that we're promoting life and that we're promoting life in all aspects. And how we do that, I think is it's just so important that there is just an equity in how we use words. And so that's
yeah, I agree 100%. I mean, from my perspective, if we use terms like escalation, it really, you're really talking about protecting, ourselves versus working with the family. In other words, you eliminated the family altogether. You've eliminated their grieving process. You've eliminated all conversation. I would hope that instead of having an escalation policy or an escalation protocol, more organizations adopt the term normalization. Call it whatever you want, but it's normalization. And what we're attempting to do is normalize our interactions with the family to understand that they're grieving and we need to become comfortable with their grieving. We want to also normalize medicine because what you're doing when you escalate, you're protecting the medical community. The medical community need to be also vulnerable. They also need to be in a learner mode versus a judgmental role. I think really we need to normalize organ donation. So in our psychology, I guess, using the term escalation, I think puts you in a different mindset. So I think really if all three estates can eliminate that term escalation, I think we will all be better off.
Yeah, it's interesting, Glenn, when you even say that word escalation, automatically our thought process goes to that fight, flight, and freeze response, right? The adrenaline.
Yeah, exactly. Exactly.
Normalize, kind of just calms it down. Yeah.
Yeah. And especially when you listen to Ingrid, knowing that a family is grieving and they're probably grieving in their own language, which many of us do not understand, you know, we've already handcuffed the whole situation. We're not being sensitive. I mean, it's just wrong.
So,
Yeah.
Glenn and Ramona, I'm so glad that you brought this topic into the conversation. You introduced it, because if anyone at any point in time there at the Hampton Inn would have called for escalation, it would have been a match on a tinderbox that went down like an inferno. And I'm not exaggerating. There were many, many moments where racial slurs were shouted, where bigoted statements were being boistered in front of numerous people that were already traumatized. If any one of us had chosen at that moment to say, this is more than we can handle, we would have been taken away from the resources that were already actively protecting the hospital across the street from us that was in a code silver. There were already armed individuals all around us. And the death notifications that happened on the second floor, I mentioned in the case study that there were EMTs on site, and it was for the families that were receiving the death notifications. And the way that people grieve is not for you to judge. It's not. It is absolutely their right in that environment to express it, whatever is natural in their response. And I was hyper aware of the fact that if anyone had made a move towards anything other than normalizing, we are going to treat everyone with the same respect and share love and light and hope. And we are not going to be a part of this problem that's already unfolding. We are going to be a part of the healing and the solution. And we are going to treat every person, regardless of what they said, with the same respect and dignity. It was painful at times. It was difficult, but we did it. And I'm so proud of all the folks that stood shoulder to shoulder with me there and insisted on it. And if anyone needs a better understanding of how to normalize trauma, there are an inordinate amount of resources available through the ICISF, the International Critical Incident Stress Foundation, the Green Cross of Traumatology, classes on CISM, clinical incident stress management for groups, for individuals. And I was fortunate that I had training in those areas, in addition to areas around my chaplaincy, where I was able to be a part of the source of the solution and moving forward. We were all hurting. It was a terrible circumstance under which I met every one of those beautiful human beings. And I hope I never repeat it.
Yeah.
But if any of us had called for escalation, it would have turned into an even greater tragedy. And I am
May
certain.
if I may
I
add
think-
something real quick. I just wanted to add, how just for us to think about with that word escalation, our communities of color already have huge distrust of medical healthcare and the law enforcement systems.
Absolutely.
And so you throw that word there and it's just fire. You throw those interventions, escalation or de-escalation interventions there, and then, what will be the result? I just wanted to add that layer there.
No,
Well, I
I
wanted to
agree
also
with you
add.
that,
Oh,
I'm sorry.
go ahead.
No,
Go
I agree
ahead.
with you that, again, that trigger word, security, is a trigger word.
Mhm.
And Sherry, I think, again, I just want to applaud everything that was done, and you taking power. Again, that's the power of words and the power of allyship, that you directed and defined the narrative. And because you directed and defined the narrative, it would not detour to say things that could be more volatile. And I think it's just amazing, something that for all of us to learn from. And that's the power of who lives and who dies and who tells.
Exactly.
Yeah.
Well,
think-
anecdotally, I wanted to share something Las Vegas will be hosting the Super Bowl in 2024. So our first responders are starting to practice, and they had, I was able to observe their first responder exercise, and I was aghast. All the first responders were not diversified. All of the patients were English speaking. And, you know, when you look at our demographics in Las Vegas, we are very diverse. Were there any Asian patients who could not speak English or would use, you know, their language? No. There were maybe 2 African Americans in this practice session. I mean, I was aghast. I made the comment, you know, that we're in trouble. So, you know, the practice needs to change.
So I'm just kind of noticing the time and just wanted to, I think this was just incredible insights just now about the word escalation. And I love what you said, Ramona, how security can mean something very different to different people. I think that was a very powerful insight and helpful reminder, Sherry. It's really important to allow, who are we to judge anybody's way of grieving, right? And the emotions that they're going through, that is so unique to that individual. And definitely, I agree with you, Glenn. I think sometimes as healthcare professionals, we can run that risk of judging that because we're going through our own expectations. So it goes back to that cultural humility piece of, right, it's not about me changing me, it's about me respecting them for their values and what's important to them. So Kareem, I would love to hear kind of your thoughts right now about, you know, just how do you know that you've triggered someone? How do you address that? How do you repair that interaction? And how do you kind of change somebody else's language if you're feeling uncomfortable about something that they're saying?
Thank you. Well, I want to start out by sending condolences to the families, you know, of the victims, and to as well acknowledge the victims, acknowledge the tragic incident. As was said earlier, as I listened to the stories, as I did my own research, I became triggered as well from, you know, what had occurred. And what comes to me is a saying from our holy book as Muslims. There's a verse that reads, to save the life of one person is like saving the whole of humanity. It also says to take the life of one person is like taking the life of the whole humanity. So it was really devastating what had occurred. Unfortunately, I think in the time that we live in, we've got to prepare for these situations, unfortunately. I think my takeaway, because I did a lot of listening in this session and took a lot of notes, and I'm learning quite a bit, and I'll try to answer your question, but I wanted to point out some of the things that came to me. In that environment, what emerged was that you had the teams, the healthcare teams, that had to really be a team at that time. And that was one group. You had the families of the victims, and that was its own cohort. You had the actual victims. And there's a particular listening and alignment that's needed on all these levels. These are all different levels of our social gradient. I've studied this idea that really are, as humans, our lives are broken into these levels of social gradient, which starts at the individual, and it goes from the individual to the family, and to tribes, then neighborhoods, communities, and it goes up from there, your nation state, your nation, globe, international. And so in that instance, we're dealing with this nightclub incident. If you think about the gradients of relationships that were present, in order for Ms. Berger to understand what to do, she had to be in a particular listening for one. She had to have a particular alignment with her team, right, early on. And she did a certain level of listening to understand at that moment, being that present. And that's part of it, like really being present. Oftentimes we'll find in our conversations from day to day, most people just are not present inside of our conversations. And you can tell because a lot of times people will answer a question that you didn't ask, right? For one, and you're trying to understand, how did you get there? In a situation where you have trauma, it's even more important, all right, to have like a deeper listening, because you could actually miss something that could really be, have devastating impact if in fact you don't get it right. In terms of understanding where you perhaps have said something that you shouldn't have said, I mentioned practice art of quantum listening in a prior planning call that we've really developed this understanding. And quantum, the use of the word quantum is to take the smallest part of a thing. And we've also taken that understanding to mean that, something that you actually go deeper inside of, right? So take the smallest part. When you think about listening, we listen in a quantum level by listening with all of our senses. All right, it's not just about what we say, nor is it just about what we hear, but it's what is it that we see in a person when we're communicating with them? What is it that we listen to and hear around us during the time that we're having that communication? I'm certain that at that time, Ms. Berg picked up that, wow, we're having issues all around with people who are speaking a different language, and she could see the trouble that was actually happening all around her and understood we need interpreters. What is it that we taste? In other words, we say, and then our touch. And getting into that level of listening actually takes you to a whole different dimension in terms of being able to respond in a way that will actually have an impact. If it is that you're really just interested in being right in terms of what you're saying, then perhaps you don't need quantum listening. However, if the intent is to influence a better outcome or to have a breakthrough, then understanding completely what you're hearing and then utilizing all those available avenues help you get to those outcomes. Mm-hmm. I hope that in some way answered at least part of your question.
Definitely. I think that's a very powerful suggestion for all of us to embrace. I think, especially in today's world, it's easy not to be a good listener, and it's much harder to work on that skill of that deep listening, like you said, being fully present, and how much just listening, how much healing listening can bring to somebody.
I think also what we need to really remember is that the Pulse incident is a mirror of things that are still occurring. October 1st, 2017, we had the massacre here in Las Vegas, where 60 people died and 400 people were shot and injured. This city is still grieving, they're still hurting. But we've had shootings in synagogues, schools, shopping malls. So, what we learned here can be certainly applied to all traumatic events.
Yeah.
I think I just wanted to make sure that we all are aware that we may be focusing on this one incident, but it's really applicable to all traumatic events.
And I might even suggest, even on a micro, just the family, an individual family who's going through a trauma,
right,
applies across the board. Yeah.
Yeah,
again, I just want to be respectful of the participants' time and the panelists' time, because we are a little bit past the hour, and I recognize some of you may have not planned on being part of the discussion that we're going to move into. So if you have to jump off at this point, we really, really appreciate your time, and thank you for being part of this important discussion. We do hope, though, that you will choose to participate in the breakout discussions, because at this point we would really love to hear from all of the participants. I think there's so much to learn. We've heard some really important insights in terms of different terms and what they can mean to different people. And so, Deanna, do you want to, one more thing I wanted to mention, there are some really helpful resources that will be in the handouts that will be sent to you. And Deanna, I just wondered if you want to kind of lead us into the breakout discussion time. I think you had some slides.
Thanks, Heidi. I'm happy to kick us off and transition to the breakout discussion. I just want to thank everyone on our panel so much for being with us today and for sharing all of your valuable insights. I really do think, or at least I hope that those of you who are in attendance today found value in a lot of what was shared. And to Glenn's point, I think a lot of it is applicable to not only the Pulse incident, but also any traumatic event that takes place or in our current practices of donation and transplantation. I hope you found some takeaways and lessons that you can apply to your everyday practice. So with that, for those of you who had interest in participating in our breakout discussions, we'll go ahead and transition to that segment of today's program. Certainly, if you have to hop off, feel free to do so as well, but we hope most of you will be able to hang on with us. So with that, Heidi, I know you had some agreements that you wanted to share with the group. So
Yes.
you to share those.
Yes, just before we go into the breakout discussions, we'll have about 15 minutes for that. We do want to just respectfully ask you to agree to these agreements because we do want to recognize the sensitivity, excuse me, of this topic. Deanna, do you want to put in the points, please? Excuse me. I encourage you to stay curious and open and do share with each other. At the same time, don't try to convince other people of your opinion. I think it just simply share. And then if you're listening, I encourage you to suspend judgment and be eager to listen and learn, which means also asking questions. Embrace the differences in perspectives. That helps us to learn and grow and strive to make each other feel valued. Deanna, you have some questions for us.
Thanks, Heidi. So as we transition into your breakouts, we wanted to pose these questions and certainly offer them for you to discuss amongst yourselves within your groups, but certainly if you feel really empowered or really touched by something that was covered in the panel discussion, feel free to make that breakout discussion unique to you and kind of what you want to prioritize and highlight in your individual breakouts. But some questions for consideration, as a healthcare community, how can we make effective changes to promote inclusion and belonging? So for example, how can we adapt our language and behaviors? I think one thing Glenn and Ramona mentioned earlier in the discussion was just something as simple as changing a term like escalation to normalization. So considering that change, that small change, what other changes can we make to promote that belonging and inclusion as we serve our diverse communities? Another question for consideration is how can we effectively support families and our patients when they have conflicting values? So again, a lot of what we touched on earlier, families may not have been aware of their loved one's status as a member of the LGBTQ+ community. So understanding those differences, maybe differences in religious values, same-sex marriages or partnerships. So how do you go about navigating those unique circumstances to make sure that you're effectively supporting your families, but also honoring the wishes of your potential donor or the patients that you serve? So with that, I'll have these slides up and available for you to take a look at as you embark on your conversations. But feel free to take a screenshot if that's helpful to you as well. And again, you don't feel married to these topics. Certainly you can take the conversation wherever you'd like to go. So with that, I'd like to leave the remaining time, 15 minutes or so, for all of you to have those discussions. We'll have some members from our panel in your breakout discussion. So if you have any specific questions for them as well, you can feel free to pick their brains as well. So with that, I'm going to go ahead and transition us over. So safe travels, everyone, and we'll see you back in about 15 minutes for our closeout and wrap up. Okay. Heidi, I don't know if you wanted to add anything there, but I'll go ahead and move this over.
All right. Well, I hope everybody had some really great discussions. I know with breakout sessions, sometimes they just don't feel long enough. So hopefully you had an opportunity to talk through things. And again, just on the screen, here are the services and resources for you that Sherry so kindly shared with all of us. I think I'd just like to close out by first and foremost thanking all of the panelists and especially Sherry for sharing such a intimate and challenging, terrible, horrible day, but yet having the courage to share with us what you have learned and the insights you have gained. That is really challenging us to think and look at things in more depth. And I think this was really, really important. And I'm glad that we're going to continue this conversation because, like we identified, there's a lot more to unpack in this. Thank you to all of the participants. I think what we've really learned today is words have meaning. There's a proverb that says the tongue has the power of life and death. Speak life or death, or we can build up people or tear people down. And sometimes it might be unintentional, right? But this is where we have to be bold in being willing to learn and ask important questions so that we can grow, and sometimes be comfortable with being uncomfortable and asking those questions to grow. I think some of the tips I took away today was using the term they and practicing that, and considering that the terms that some of us might take for granted could have very different meanings for different people, such as the word security or the impact of the word escalation. Those were very powerful insights. And also to recognize that we all need a safe space, but that when that safe space is terrorized in that way, it creates a lasting scar and damage that I think we can't gloss over. We can't just brush it under the carpet and just move on. We have to identify what we can learn from it. And then the wonderful tip Kareem shared with us, that it's really important that we listen deeply and apply that quantum listening, or I like the word deep listening as well, where we're really present, and how much healing that can bring, but how important that is for us from a learning perspective as well. So thank you again to all of you panelists. Thank you to the Alliance for hosting this important conversation. And thank you to all of you participants for being part of this conversation.
If I may just interject,
Mhm.
I shared with our breakout session, UNOS is it's open for public comment. The UNOS is proposing a policy on transgender sex reassignment and the impact on MELD scores. So, and the second one is GFR calculation, eliminating race as a determination for kidney transplant. So those two are out for public comment. I would encourage you to jump on UNOS to provide your comment. I will ask, ask Deanna to add these two things to the handout material. Thank you.
Great, thank you very much. Well, thank you, everybody. Wishing you all a wonderful day. Thank you for all the work that you do.
Thank
Hi,
you.
everyone.
Thank you for being a great moderator.
Yeah, I would agree. Yeah.
Great panel and a great moderator. Thank you,
Yeah.
guys.
Thank you.
Thank you, everyone.
Thank you.